Hi, I'm Dr. Arturo Loaiza Bonilla, a practicing medical oncologist and researcher, and also the co-founder and chief medical officer of Massive Bio. And today we're going to have a brief conversation about colorectal cancer and how to improve access to care by getting patients into clinical trials. And also give you a little bit of information about colorectal cancer for those who are not yet familiar or they just were diagnosed with the disease. What is colorectal cancer and how does it develop? Colorectal cancer is a type of cancer that starts in the colon rectum, as the name says. It typically starts with a polyp or a lesion that over time it starts to get mutations or changes. And those changes to the DNA lead to the appearance of cancer. And that's typically when we find those cancers present. And in many opportunities, we can detect those things before by doing colonoscopies or certain non-invasive tests as well. And that's why it's so important to do screening for every single patient starting at the age of 45 years old. What are the risk factors? Well, there's many risk factors for colorectal cancer. Several factors increase age, as we know. That's anyone over the age of 45 should start screening for this. If there's a strong family history of multiple polyps or colorectal cancer, or a personal history of inflammatory bowel disease, those patients who have, Crohn's disease or ulcerative colitis, though those patients are at risk, and they typically know it very well because they're dealing with that disease since they're younger. Some patients with certain genetic conditions, eating high in red or processed meats, a sedentary lifestyle, so diet and exercise is also helpful. The smoking, excessive alcohol consumption, and decrease of fiber intake are some risk factors. But of course, it can happen sporadically, regardless of you doing everything right. It's just something that can happen. The early signs and symptoms of colorectal cancer could be bleeding, could be issues with changes in bowel habits. It could also be patients who all of a sudden start to see, changing color in the stool, maybe having, it could be, red tinge or just overall changes. I think it's always warrants to talk to your primary care doctor, your gastroenterologist, and try to get tested. Can it be prevented? As I mentioned, it could be prevented. A diet rich in fiber, and following screening guidelines, because if it's found earlier, you can really prevent it from becoming a more aggressive disease. And what are the stages of this cancer? So the stages means the extension of the cancer within the bowel itself. So stage 1, typically a tiny lesion that you can remove or scoop out sometimes, but typically requires still some form of surgery. Stage 2 is when it has taken the wall of the bowel, but it hasn't gone beyond that. Stage 3 is when it has gone to the lymph nodes, which are the tiniest stations surrounding the bowel and every single one of our organs. And it's just like escape pods, the places where those cancer cells try to escape to get into the bloodstream and other organs. And stage 4 is when it has unfortunately has left the organ and just gone elsewhere and it's bloodstream now. And those are patients who are found to have what we call metastatic disease. The treatment of colorectal cancer is very vast, and there's a lot of different options depending on the sidedness of the cancer. So you came from the right side to the left side. Actually, there's different options. Why? Because they are different in their molecule, in the DNA level, the biomarker level. They're different. And something that we strive for always is doing genomic testing and also doing biomarker testing overall by looking at the key features, the key markers that can tell us a little bit more about that cancer, because that can really make a difference in how we can treat those patients. And that's something that I always encourage anyone. So please ask for genomic testing, particularly in a patient who has gone through, already advanced disease. When you do it early stage, when the treatment is surgery, of course, surgery is the way to go. And maybe some testing that is happening is more about to monitor the patient over time to make sure things are okay and they remain okay, or if they need chemo or not. But for those with advanced disease, the best option for them is to get tested, to get personalized treatments, and look for clinical trials, which is one of the things we wanted to talk about here, right? So patients overall have, hard time to find clinical trials. Out of the last millions of patients being diagnosed with cancer, unfortunately, only 0.1% get access to clinical trials. And those who got access to clinical trials did much better than 99% that actually didn't get it. And at the same time, many clinical trials are closing. So how we can make this better? Is there any solution or a way to connect the dots? And the answer is yes. We need to make sure that everyone's aware of clinical trials. We know patients, particularly patients from Hispanic origins like myself, or Black patients, they also have sometimes an increased risk of cancers, including colorectal cancer being very frequent. And still, because for many reasons they are found to have metastatic disease, they don't get access to clinical trials. So you may not be eligible for any of their clinical trials at that given time, but in the future that can change. And there's no way to keep track of it unless you use technology. So that's exactly what Massive Bio does for patients and providers and physicians, which is getting that information in real time when the patient needs it. If they already started treatment or there's no trials available in the local place, then they can use the same tool and technology using AI. We welcome any opportunity to make this better. As you may know from some of my history, I co-founded the company because of the situation that I had personally with my brother dealing with leukemia. And I'm a GI oncologist, so I see patients with colorectal cancer, with gastric cancer, pancreas, you name it, every single day. And one of our commitments is to make sure that no matter what, the patient gets information that really makes them empowered and in something that, is helpful for them in real time. So let us work together. Let us, come at this journey to really make the life of cancer patients better. And I thank you for the time and the opportunity to discuss today how we can get access to patients to clinical trials, particularly those who come from underrepresented minority backgrounds, because that's a key component of things that we need to help everyone. And even those who have less access, we should really go there and help them. So thank you so much.